Hello, my name is Julia Craig, and I am a second-year medical student here at the University of Alberta. I'm a student investigator that helped develop this project, along with Dr. Tilini Rajapakse, a pediatric neurologist and headache expert here at the University of Alberta in the Stollery Children's Hospital in Edmonton. Other individuals that are part of our research team is Dr. Bethan Kinsley, who is from the Women in Children's Health Research Institute, and she is a qualitative methods expert, and Taylor Ness, our amazing patient partner who we will introduce more throughout the presentation. Thank you very much for having us here today to present at the 2022 NWSPOR Collaborative Forum. Our project is a focus group designed to understand the pediatric patients' perspectives on neurostimulation for migraine treatment. This project was conducted out of the headache program at the Stollery Children's Hospital, which is a multidisciplinary clinic that serves pediatric patients who suffer from chronic, often refractory headache. So what is migraine? Well, the International Classification for Headache Disorders defines migraine as a headache that occurs 15 or more days per month for more than 3 months. Migraine is a chronic disease that affects many. 1 in 10 children and adolescents experience migraine, affecting their development and contributing to a lower quality of life. There is no cure for migraine. Instead, the disease is primarily managed with medications that have varying efficacy and side effects. An emerging treatment category for migraine is neurostimulation, and one such promising therapy is Cephally, a wearable medical device that provides electrical impulses to the trigeminal nerve branches in the forehead involved in headache generation. This device is pictured here with me wearing it. Cephally is FDA approved for treatment in adults, where clinical trials have found Cephally to be effective both as a preventative treatment and in treating migraine attacks. These studies also demonstrated numerous advantages. Cephally is non-invasive and it can be administered at home. This possibly can decrease the need for access to hospitals and reliance on medications. Based off of these findings from adult studies, it is reasonable to conduct a clinical trial to understand and to investigate Cephally for the treatment of migraine in adolescents. Alongside the design of this clinical trial, Dr. Rajapakse is conducting a focus group to receive patient feedback and understand the practicality of neurostimulation for migraine treatment in pediatric patients. This study is currently ongoing, but here we will present our methodology for conducting patient-oriented migraine research. So here our goal was to recruit 10 adolescents to participate in the focus group. There has been great enthusiasm, so we may actually increase this number. Participants are asked to participate in a 1-hour virtual focus group conducted over Zoom, where they will be asked questions pertaining to their current migraine management strategy, will be shown the Cephally device demonstrated on myself, and then they will be asked their perspectives of the Cephally device and whether they would attempt using it for treatment. In designing our focus group, prioritizing patients and ensuring that our research group reflected the diverse community we live in was of the utmost importance. Our research team is comprised of 4 women with varying intersecting identities and experiences relating to gender, race, class, sexual orientation, rural and urban upbringing, age, and stage of career. We also work with community nurses and patient partners who have different lived experiences with migraine. Our diverse team helps ensure appropriate representation and mindfulness towards EDI-oriented research that reflects the makeup of the populations we serve. As mentioned, this study was conducted virtually, allowing for adolescents from all over Alberta to participate. We also worked with NWSPOR to share the recruitment posting and recruited participants through Dr. Rajapakse's clinic. To prioritize patient comfort and discretion throughout the group, or throughout the focus group, participants were asked ahead of time which gender group they would like to participate with, and are also invited to use only their first name and/or their initials. This project is very collaborative. Starting early on in the project design process, we met with NWSPOR. We also met with Dr. Kinsley from Wickery to help us design the focus group script. and to review our methodology to ensure that we can achieve robust and meaningful results. We're very fortunate as well to work with our amazing patient partner, Taylor, as part of our migraine research team. So Taylor Ness is our patient partner. She is an engineering student at the University of Alberta and lives with chronic migraine. She helped us review our focus group script ahead of meeting with participants and is also helping to facilitate the focus group. We also plan to invite her to collaborate on reviewing the manuscript and any other opportunities that arise. She has been a wealth of knowledge, helping to contextualize the patient experience of migraine management. Traditionally, migraine research has been conducted by physicians with little opportunity for patient input. The world of migraine, pediatrics, and more broadly, health research is starting to make the necessary transition to conducting research using a patient-oriented approach. Kiata and colleagues from Columbia recently published their results from a focus group they conducted that investigated the pediatric patients' perspectives on outcomes and treatment preferences. Building off of this work, we hope that our study will provide valuable baseline knowledge as to patients' perspectives on neurostimulation, setting the groundwork for investigating future migraine technologies using a patient-oriented approach. Thank you very much for your time here today, and thank you to NWSPOR, Wickery, Alberta Innovates, and the Stollery Children's Hospital Foundation for your incredible support. We couldn't do it without you. Thank you.